All right, well, thank you for tuning in with us today. I'm Jen from Jen's Tangents, and I'm here with Natalia. And I wanted to talk a little bit about injectables today with her. So we're going to be discussing where you can put different injectables and maybe the benefits of what they do and what they are. So let's see, first kind of question, and Natalia can give me your background, medical background, and what it takes to be someone that can do injectables.
So my medical background includes a nurse practitioner license, which is a master's degree level. I went through WSU, and essentially what my program entailed was a family nurse practitioner program. And then you can certify in medical aesthetics, by taking a training course. And then you have your, experience on the field, and that's how you kind of acquire your art and your skill as you go.
Okay. Do you have mentors that you follow, or has it been just kind of learn as you go?
Yes, I was trained by a great professional, and she taught me the pearls of injecting. I followed her for a good time, and essentially kind of, dwelled into my own kind of, eye for art and injecting, and then kind of took off on my own.
Yeah, I had no idea there was art in injecting. So that makes sense, though. Natalia, if you can point out on my face different places that you would do injections, you're welcome to point with your finger. You can touch my face if you want to.
So injectables in sense can be used preventively or correction-wise. So preventively, a lot of girls would come in and they would ask, what is the age that I should start injecting Botox into my face? And I'd say, anytime you can make a frown is usually a good time, and usually those frown lines are seen right here in these areas right here where Jen is trying to frown.
But I'm going to admit that yes, my forehead is done.
There you go.
But I have plenty of expression.
So that's a good thing you bring up, is the fact that when we do get rid of your wrinkles in the areas that you frown in and where you have a lot more expression, when you do paralyze those muscles, they tend to not have as deep wrinkles as you age, and so you really are preventing aging. Correction-wise is when you already have those wrinkles and you have to, really work hard. But you know what I mean, like every 3 to 4 month periods of injecting the Botox to really fully get them to soften up. Because it took you a few years to get those lines, it might take you a few treatments to fully get them away.
So can you see on my face any place where I've got the wrinkles that might be really challenging to get rid of?
What I would recommend is where your eyes focus. So when you talk to a person, where do your eyes usually go to in the face? My eyes always kind of go into the frown line areas, and then they kind of go towards the lip area. A lot of people have a little more lines as they age around their lips, and so those can be targeted with a tiny bit of Botox and a little bit more filler. Those are the areas that you really want to focus on. Those are the youthful places that your eye draws towards too. Sometimes people's foreheads are hidden with bangs, so they can hide their lines in the forehead, but those are some areas that I'd recommend focusing on, to get rid of, and especially the crow's feet. We smile, we have a lot of expression, so as you can see, when Jen smiles or has expression, they tend to crinkle up, and so softly, paralyzing those muscles, you can get that effect of a refreshed kind of, I just went on vacation look.
Okay. Difference between fillers and Botox.
Right. So Botox is a neurotoxin, so it helps to paralyze the muscles by preventing neurochemicals from being released in the muscle area to stop from contracting. So when you don't contract your muscle, so go ahead and lift your forehead. So you see how you can still lift it a little bit, but not as much. So when you can't lift your forehead as much, that means they're not contracting and those lines don't form. And that lasts for about 3 to 4 months on most people. And that's why the Botox treatment, Botox or Dysport, the neurotoxin treatment should be repeated every 3 to 4 months. Fillers, on the other hand, tend to give you more volume in the areas of volume loss as you age. So that is usually seen in the cheek area, because as we age, gravity takes its toll and tends to pull things down in the lip area and the nasolabial area, which is
this one right here,
right between the nose and the cheek. And so that kind of helps to bring all that volume back up. It's really a sugar particle, and it's what your body naturally makes, hyaluronic acid. And so
hyaluronic? Hyaluronic, yes. That is actually in a lot of cosmetics and serums. So
And when you inject it into the area that has volume loss, then you get that sensation or that look of being lifted. So it's kind of like a liquid facelift, what I would say. Non-surgical.
Non-surgical facelift. Different places where you can put it. Talk to me about that.
So you can put it pretty much in all the areas that have volume loss. We like to start with the cheek area because that's where you want to build your foundation to pull everything back up as we age. You can see where I pull your cheek up, how everything kind of starts to lift. So you want to start with the cheek area if you have more hollowness in the cheeks, and that'll lift your nasolabial lines a little more.
Okay.
And then you can kind of etch in a little bit more filler into the nasolabials. And of course the lips. Lips lose a lot of volume as we age.
They deflate.
And so the filler helps to kind of plump them up, and depending how much and the technique you use, you can get away with a very subtle look, which I love. And so people, you know, get really scared of, I don't want to look too done. And so just the technique and the filler you use can definitely, you know, offset that and give you a really beautiful natural pout.
A pout, okay. What about Restylane versus, what is the other? There's Restylane and Juvederm.
So there's two different companies. They're all great fillers. I would say that depending on the plump you want to go for, let's say Juvederm Extra Plus XC is one of your most volumistic fillers. So if you want that really beautiful pouty look, you would go with the Juvederm filler.
Okay.
If you want more of a subtle look, you would go with a, you know, either a Restylane or like a little Bella look, and they'll give you a little bit of a mini lip.
Mini lip. Okay, well I would probably want a little more volume.
Then you'd go with the Juvederm Extra Plus, yeah.
Okay. And then also I've heard about Kybella. Tell me about Kybella.
Kybella's a great...
Am I saying it right?
Yes, it's a great new product that helps to treat the underneath the neck fat permanently. So
it's not skin, it's that you're treating, it's the fat.
It's the actual fat underneath the submental area. So what happens is as we accumulate the fat underneath our chins, it makes us look a little more fuller with a less defined jawbone. So when you put Kybella into that area, it permanently gets rid of those fat cells, and your body clears out those fat cells. So it's a permanent solution to that area. The treatment is dose dependent on each person. Usually it takes 2 to 3 treatments to get a good correction.
Makes me think of a goiter. Is that different?
Goiters are more towards the thyroid.
Okay.
This is really underneath the chin.
This is just fat.
Yeah.
The fat there. So if you have a big,
yeah,
worried about the double chin. Right?
Double chin fat.
Double chin.
Yeah.
Okay. What other questions? Can you kind of
I think we tackled all the main questions people have about the neurotoxins, fillers, and what's out there. So definitely get on and get treated.
Oh, okay. So here I think with the word toxin in there, is there anything that we should be worried about? Is there permanent paralyzation? Any damage like that?
Not that we see research on. I mean, essentially, it's been used years medically for medical purposes in very high doses. And we've got FDA approval for cosmetic usage in certain areas of the face, and we use it off-label in so many different areas of the face. But no, it's definitely a safe product to use.
Wonderful. And I know people use it for migraines. So
there you go.
Right. Well, thank you very much,
You're so
Natalia. I
welcome.
appreciate it. And in the future, hopefully, we'll have a live model getting something done.
Exactly. Coming soon.
Coming soon.